So I've been wanting to try one of these, I don't want to say a day in the life, because who really cares about a day in my life right now? But I've been wanting to kind of just record, you know, like a normal day as a nursing student. And today is actually our first test of our last semester. And I don't work the nights before I have tests, so I'm able to wake up and kind of get a fresh start. My mind and my brain, everything will be very fresh. I'm not coming off of a foggy work up all night brain. And I'm like, well, I'm gonna try to kind of just show you guys my routine on the days that I just have a regular day. We have one day every week for lecture. That day is 4 hours. It's broken down into 2-hour segments. So this morning we go from 9 to 11, then we have a break from 11 to 12:30, then we go back from 12:30 to 2:30. Since today is a test day, we will be taking our test, the first portion of the class. To just let you know, like I said, we have to be there at 9 a.m. I woke up about 6 a.m. My body, just for some reason, just wakes up at 6 naturally on its own. So I've been up since about 6 this morning. However, I took a little bit of time to meditate, and so I took some time to meditate. I kind of rolled around in the bed a little bit, and also my nursing class has a page on Facebook that we use to talk and communicate with each other, and I checked that this morning because sometimes people post pictures of different study tools that they're using that we might not have, or you know, people ask questions like, you know, I don't really know how to study for a test. That's been the big question this test. Nobody knows how to study for it because we only had 2 lectures, and this test, they say, is more about common sense nursing, like prioritizing, nursing professionalism, delegating, those types of things. So nobody knows how to study, and I honestly didn't know how to study either. My method of studying for this test is just listening to the lectures and praying that the nursing knowledge that I already have suffices. So my camera battery is going dead. Like I said, I woke up about 6. It is now 6:48. I took some time to meditate, and now I'm going to take a moment to cook breakfast. And while I'm cooking breakfast, I'm gonna also continue to listen to my lectures. I like to do that in the morning. A lot of people suggest practice questions. I had a hard time finding practice questions that I felt like would better me for the test, because this semester they're not using any practice questions from that you may have gotten out of your book, or you know, sometimes you can go and when you study the practice questions on like Passpoint or Lippincott, every now and then you might catch one of those that are similar to a question that's on a test, or your method of thinking, your rationale for the questions on like Lippincott or Quizlet that just help you study. Sometimes those same rationales can be used towards a different question on the test, but this semester they're making things very tough for us, and they're handwriting all of the tests. So, and the teacher, the instructor that's the lead instructor of this course, is a very smart teacher. She was a nurse for 40 years before she became a teacher, and she's very detailed, and everybody just freaks out about her test. But one thing I will say is the fact that she is so thorough does help aid in the test, because I have had her before as an LPN. The LPNs that are in my program have had her before, whereas the RNs that we transitioned and got into the program with last semester, who were that were in the RN program that are not LPNs, have not had her, so they're kind of freaking out. But maybe I should be freaking out too, I don't know. Anyways, I'm gonna get on with my day, and I'll try to kind of just walk you through just everything that I do in the mornings. As I prepare, I will go ahead and say, you know, last night I cooked dinner and I didn't wash the dishes, and so I have dishes in my sink. So, and also I took a lot of time to study in my living room last night. So if you peep that my house might be a little messy, I'm telling you, this is the life of a nursing student. And this is the life of a nursing student whose child is with her grandmother. So can you imagine if there was another little person living in here? Like, my laundry, my dishes, everything would be magnified. So forgive me if my house is not up to par. However, that is not the basis of this video. That's not what this content is about. Please take this video for what it is worth. All right, thank you guys. All right, here they go. So I have sat here and listened to about 55 minutes of the lecture while also getting dressed, and I'm not gonna act like I feel really confident, because I never really do, honestly, because you just never know what's gonna be on the test. But I am getting nervous just because I know it's gonna be more select all that apply, and the select all that apply is like my hiccup on the test. So they're putting more of those on the test this semester, and I'm just very nervous about that. And so yeah, but about to head on out, and y'all just pray for the kid. Pray for the kid. Damn, I dropped my keys. It's all fun and games till you get to the door and you drop your keys and you gotta pee. But anyways, keep my little window open here so my little plants, look y'all, my little plants, they are actually doing really good. Well, that aloe, I mean, you can doctor aloe up, so even if it isn't doing too good, if I take the time, we can get it right. My pothos here, I don't know how to, let me just, my pothos here, she looks really good to me for it to be the wintertime, especially because I've seen a lot of people's plants who just aren't green at all right now. So I think I'm doing a pretty good job with her. But anyway, yeah, that testing anxiety is definitely starting to kick in. Also, what time is it? Let me turn the speaker off. It is 8:11. I'm heading out. I live very close to school. It takes me like 12 minutes in the mornings to get to school, and so I'm just leaving a little bit earlier than usual, because another thing that my teachers require sometimes are, ooh, I need a coat. Hold on, y'all. Okay, I'm back. Ooh, poor eyebrow etiquette, but hey, that's the life of a nursing student. I don't have time to look pretty. I don't have time to do my makeup or put on any eyebrows or none of that. None of it. But as I was saying, I don't even know what I was saying. I'm nervous about that. Oh, I'm heading to school a little bit earlier because sometimes our teachers for lectures and for lab require something called a ticket to class, which is basically like homework that you have to bring in to class. Sometimes it's just a few questions. Sometimes it's like a case study, just something to help you better understand the information that you're going to learn in class. So we do have a ticket class, and I do need to print it off, and I don't own a printer. So again, if anybody would like to send me a Best Buy card or some money, because I need a new memory card and I need a printer, fax machine, all of that. Yeah, if you... Yeah, so I'm going to class early. I'm just going to the school a little bit earlier. If I can get there. As you can see, it's I didn't expect it to be like that. I should have warmed the car up. But so I can print off that ticket to class, and y'all pray for me, please, because I don't feel, I'm starting to get that real bad anxiety. I mean, only people that have been in nursing school understand that anxiety that comes before you sit down and take that test, and it stays until you finally see your grade. So it has arrived. It is here, and I have 45 minutes. It's exactly 8:15. I got 45 minutes before the test, and yeah, I don't know what to do. So I am walking to the computer lab. As you can see, I got headphones in because I'm still trying to listen to some lectures. I got 20 minutes before the start of class, and I'm about to take about 15 of them to print this off. I need to pick up put a little pep in my step. Also, sidebar, I shouldn't have checked Instagram because I just saw that Beyonce sent Kim Kardashian some Ivy Park gear, and she ain't sent mine yet. No, I'm joking. But I mean, Kim, she looked good in it, you know. However the plastic is made, you know, the shape of the dress is going to fit. No, I'm just playing, no shade. I ain't got no beef with Kim, you know what I'm saying? We cool or whatever. But no, but that just kind of took me off guard because I didn't know. That's just, I mean, I don't know how y'all feel about that. If y'all are into like the little celebrity gossip kind of world, which I kind of find interesting every now and then, just to, you know, dibble and dabble into reading a little drama, because I have none in my life. But how y'all feel about that? Beyonce sending Kim Kardashian some Ivy Park gear, and I'm trying to figure out when she gonna send her fans. Not saying I'm a diehard B fan, but you know, just send the people that really support her and pay for the stuff. Just send your fans a little bit of free gear, you know. Go through the little list of names that ordered some stuff for you and just throw a little free stuff in there for them, you know. That's how you get them, B. That's how you get them. But anyways, almost to the computer lab. Test time. Again, lecture day. Life of a nursing student. So the test has been taken, and now after taking the test, I have realized that there was no possible way to really study for the test other than doing practice questions. The test, who is the person, that's which patient is priority, those types of questions, and really you can only get better at those by just doing them over and over. And so I don't know if the test was easy or hard, because you never really know till you get your grade. So pray for your girl.
Girl, don't look at me, child. This forehead, well, you know you got your A.
Yeah,
you on the 18.
No, she on the 18.
You on the, she on the 18. She on the 18 for real.
So we have made it through the first part of our class today. It is now 11 o'clock, or a couple minutes till. I am about to actually go home, because another reason I wanted to film this video today is because I also have to go to work today. Today is my double day, which means I work 2 shifts, which means I work a total of 16 hours. So I get out of class at 2:30 today. I have to meet with my teacher because, as I told you guys before, we have to have volunteer hours, and we also have to get signed off on where we go to volunteer. In the days we chose to volunteer out there, we have to have 32 hours of volunteer time between now and April, which is not a long time. But anyways, so I have to meet with her after class at 2:30 to get my volunteer form signed off, and then I'm going straight to work. So I'm actually gonna go home. I cooked dinner last night, so I'm gonna go home and eat. And hey, Olga. And after I eat, I am going to go ahead and get dressed for work, so I can leave from the school and go directly to work tonight. So I shall see you guys in a little bit. So this here is my balancing act. I don't even have the screen flipped up, so I don't even know what kind of angle I'm looking at the camera at. However, this is me making sure I have everything I need, my cup of coffee, my shoes. They are dirty, but once you see where I work, you'll understand that I will never wear a clean pair of shoes in it. And my computer bag, because if I do have any downtime today, I'm going to take a minute to try to edit this video. And I am off to the races. It's like 12:15 almost, so I'm pushing it. We're trying to get back to class on time at 12:30. I'll probably have to get a seat in the back because all the seats in the front will be taken. Okay, bye-bye. So it is 2:53 and I have completed class today and I have met with my teacher, and now I'm supposed to be at work by 3, but as long as I get there by 3:30, I feel like I'm doing the right thing. We will talk about things that I am working on and my weaknesses as a nurse in another video. And you will see that tardiness may be one of them, which is frowned upon. Do not be like me, be better than me. But yes, so I'm about to pull off from school and head to work. But I did want to tell you guys that I made an 82 on my test today. I'm actually pretty glad I made an 82 as long as I passed. It's the first test of the semester. And just kind of hearing the grades that other people made, I'm probably in the average category. You know, I heard like 78, I heard 84, I heard 90, I heard, you know, a few different grades. And so as of right now, I don't think I'm doing too bad. I'm very happy to have just passed. So one thing I try to make sure I do when I leave school, whether it's when I arrive home safely or whatever, is I just want to thank God for allowing me to make it to class on time, because in this program that I am in, they are very serious about punctuality, and every time I make it to class on time and don't miss an hour off of my attendance, I am so happy and so grateful, because anything can happen that can make you late. You can be sick. It's so many reasons and so many things that happen to people that cause them to miss class. And a lot of times people don't fail nursing school because they're not smart enough or because they don't understand the material and they do poorly on the test. They do not pass nursing school because these attendance policies are no joke. You have to have a certain amount of clinical hours, you have to have a certain amount of class hours, and each one of the hours in each class day adds up. So anytime you make it to class on time and you make it through class without having to leave, you better be grateful. So I always want to take time to really just thank God for allowing me to make it here safely, for allowing me to make it here on time, for allowing me to make it through. And now today I want to give him a special shout out and a special thank you for allowing me to pass my test today. Like, I am very, very happy about that. So off to work I go.